very much, Susan, and it's a great pleasure to be invited here to give you to tell you a few things about medical detection dogs. And I think before that, a little bit about prostate cancer, because I can see, except for 4 people here who don't need PSA test, the rest of you all, minus ladies, they do need PSA test. I'm a local urologist, so a human plumber, so I deal with the plumbing issues. I fix the leaky valves, I fix the hydraulics failures, as well as cancers of the kidneys, prostate, bladder, and the genitalia. So basically, to be more precise, as you know, prostate cancer is the 5th commonest cancer in the world. And in the UK, it is the most common cancer in men. And about 44,000 people get diagnosed with prostate cancer each year. So it does become very important thing that if there are any signs and symptoms, there are no specific signs and symptoms, but there are symptoms which you feel is something new has developed, then you should go and see your doctor. And the doctor will offer you a PSA test. So PSA is basically a blood test. It's prostate-specific antigen. This is a chemical which is produced by the prostate gland in the human blood. Now, PSA is a blood test which is specific to the prostate gland. It's not specific to prostate cancer. So anything what happens to the prostate gland, like infection, inflammation, or if you were to have intimate relationship and you go and have your blood test done within 72 hours, PSA can be raised. And that is what sets the cat amongst the pigeons. So basically, PSA has an idiosyncrasy. It goes up when it shouldn't go up, and it also goes up when there's prostate cancer. Part of the problem is that PSA is the only test available which has been tried and tested for the last 25 years. Before, we used to have other tests. Some other new tests have come and gone, and they have not stood the test of the time. So PSA is still the test which we use because it's cheap. It is readily available. It is available in every doctor's surgery and everywhere here in the UK. We do assess the PSA levels by combining it with the physical examination. It is not cancer specific, however, it has got vital role, PSA has. PSA, for example, for diagnostic purpose, if PSA is raised, you at least get suspicious whether the patient has a cancer in the prostate gland. So you have the investigation and reassurance that there is no such problem. PSA is also used to monitor the cancer. If somebody is known with prostate cancer and PSA is going up and up like a step ladder pattern, that means cancer is active and the patient needs treatment. Patients who are being treated, if the PSA goes down, that would mean that the cancer is responding to the treatment. So it is a good tool to monitor the cancer. If somebody is receiving treatment and PSA still goes up, that would mean the treatment is failing and the patient needs to have some other modality of treatment. So this is about PSA. Now, for a long time, there have been trials of different tests to come and commercially be viable, but they have not been commercially viable because they have been very expensive. Just to give you an example on the PSA, when it came to market 25 years ago, the cost was £13 per test. So the GPs were very reluctant to do it because it came out of their budget, because it used to be the fund holding GPs. Now the cost of PSA is only 50 pence or at the most 80 pence. So it's readily available. The other tests have come and their cost was in double figures, hence they have not taken off and it cannot be commercially utilized all over the world. In 2003, there was a study called Proof of Principle study by John Church. He was the father of the chief executive of medical detection dog. He and his colleagues found out that actually the dog's incredible sense of smell can be utilized to detect cancer in people's urine. So that was a proof of principle study. They did do on 100 or 200 patients, but somehow the fizz settled down, and nothing happened after that, until recently when it was realized that this potential can be exploited. Reason being that there's a big vacancy to find a more accurate, a more sensitive, a more specific test which could be readily available, and it can be used to diagnose as an early warning system for prostate cancer. So this is the study we are conducting, and the basis is that the prostate cancer or bladder cancer patients, the cancer cells secrete a volatile organic compound, and that volatile organic compound gives the cancer scent in the urine, which can easily be picked up by a trained dog. So trillionth of a dilution, the sniffer dog, the trained medical detection dog, can detect the volatile object, volatile compound produced by the cancer cells. So this is what is behind this study. So this is the basis. There is no exposure of the patient or the person to the dogs. It's only a small urine sample, just like MSU bottle you have, that would suffice. Similarly, we do not have ladies' urine as a control group to compare and train the dogs, because ladies have female hormones, and that could also confuse them. 96 to 98% accurate. It's astonishing. That's right. I think basically not everybody needs treatment, but everybody does need detection so that they get treatment at the right time.